There are a lot of individuals that can benefit from what we do. I think there's a tendency sometimes to think of PACE as only being a solution for a small number of people, when in reality it's a solution for a lot of people.
Experience healthy independence at InnovAge PACE's new state-of-the-art center in Tampa. It's first in the state. You just heard from Patrick Blair, InnovAge President and CEO, following the March 4th ribbon cutting and grand opening that I'm told was a family atmosphere for all those in attendance. Visitors enjoyed informative sessions, demonstrations, games, food, and exciting giveaways. And we recently stopped by the center and learned how this industry leader of PACE programs tailors healthcare services to each participant. Well, this morning I'm coming to you from their brand new Tampa location, and I have Shauna Horn joining us right now. She is the area center director and is here with more. So thank you for having us. We appreciate it.
Thank you for being here.
So to begin, can you tell me a little bit more about InnovAge PACE and your mission?
Exactly. InnovAge PACE stands for a program of all-inclusive care for the elderly. Our mission is to allow seniors to live independently at home for as long as possible, and we have a whole host of wraparound services here at the center that allows us to deliver on that very special mission.
And so I have to say welcome to Florida.
Yes.
You just opened this Tampa location. Can you tell me about the facility?
Yes, it's a beautiful state-of-the-art facility. It's 35,000 square feet of center space has once again, a variety of departments and services here that helps us deliver on that PACE mission.
Yeah, you mentioned that you all are committed to helping seniors live their best independent life. This is much more than an adult daycare. Can you talk about some of the services that are under this roof?
Yes, you bet. So we actually have a primary care clinic that we're actually standing in right now. It has 12 exam rooms and one that's dedicated to our specialist providers that are able to come on site. So that could include podiatry, chiropractic care. We also have a dental suite with 4 operatories. So anything from a general dentistry standpoint will actually be provided there. We also have 5 daycare rooms for social activities that take place during the day. We also have an in-home health team for task-based gap services at home. We also have a transportation team that also provides transportation to and from medical appointments as well as dialysis appointments.
It's incredible to think that all of that is happening under this roof when there's so many seniors that spend all day going from appointment to appointment to appointment. Now, you all also help coordinate appointments to some specialty care, right? Can you talk about that?
Yeah, the care coordination happens here. We have dedicated team members that will actually perform the scheduling, coordinate all of these specialist appointments for our participants. So for those individuals that are hard of hearing or have cognition problems or wherever the case may be, you know, that really solves that problem and helps with that quality of care and compliance. So we do have dedicated team members that will actually make that phone call, will coordinate transportation even, and we'll take them to and from those appointments.
Tell me about the partnerships that you've built in this community and why they're so important with your core mission.
Yeah, so when you ask that, I really think about our social workers and the task that they have in making sure that they have identified internal and external resources and partners within the community based on whatever our participant needs may be. So if there is somebody that has issues with housing or food insecurity, then we've identified local partners that can assist in those situations. Additionally, because of our PACE model, we are the payer and the provider. So we have identified local partners that will be specialists or providers within our network that if we do not provide those services within our center, we can actually refer out to those individuals and furthermore coordinate the care, the scheduling, and also the transportation transportation to those specialists.
Now, if there's someone at home, a senior, who's interested in coming here, how do they learn more and what's the cost?
So they can go to our website or they can call the center. We do have a dedicated team of enrollment specialists as well as financial determination eligibility team that can help guide them through that process. Likely if they are Medicaid and or Medicare eligible, there's likely little to no cost for them.
Okay, I want to mention that you guys put a focus on community as well. You know, seniors are here all day and there are opportunities for them to explore new hobbies, to play games. Can you talk about that?
Yes, so we have a recreational therapy team that is dedicated to doing that Monday through Friday during our normal business hours. So they can do anything from arts and crafts to painting. You know, there's games, there's Bible study. There's so many things that can take place in there. There's one time at one of our other centers where they threw a senior prom, and that was the talk of the town for months after that. It was so much fun. You know, so those are the types of things that can happen in that space.
In closing, is there one thing in particular for you that really makes what you all do here in this building so special and unique?
Yes, I would have to say that the PACE model really is reflective of what healthcare really should be for all of us. I genuinely wish that I had the benefit of being part of a PACE program. The efficiency that takes place here and the dedication of a care team that we refer to as an IDT or interdisciplinary team. We meet on a daily basis each morning to discuss all of the needs of our participants and make sure that everything is being addressed timely and efficiently. In those meetings, you have your primary care provider sitting right next to your physical therapist, your occupational therapist, and they're able to, at a very real time, talk about the individualized care of each participant, you know, and be able to deliver on our care plan assessments. So I think that that's the beauty of it. It's genuinely a team approach, and everybody is so engaged and bought into the mission at hand.
And to find out if you or your loved one qualifies for all-inclusive care or to learn more about the enrollment process, you can visit InnovAge.com. The Tampa PACE Center serves Hernando, Hillsborough, and Pasco counties.